Hey, good morning, afternoon, evening, whenever you're listening to this. Today we're going to talk about the long-term assignment and the final product to a series of long-term assignments in this course. We're going to be talking about developing a medical algorithm. I'm just going to give you kind of a brief overview of what's expected and why we're doing this, and some differences that we use it throughout clinical practice. But then hopefully it'll give you some clarification for completing the long-term assignment. I will say I adopted this presentation and some of this information from Dr. Games, who was a professor of mine, who I did a similar assignment when I was in my educational program. So I will give him a bit of credit on not developing algorithms, but making it a learning experience. So as we look, I just want to kind of lighten the mood a little bit and what an algorithm looks like, and use something familiar if you've ever heard of Big Bang Theory. This is Sheldon Cooper's friendship algorithm, and as you can see, it's very decision-driven, right? So you see how he walks through making a decision on whether that person should enter into a friendship with him, or whether he should enter a friendship with them, rather. This is, although kind of silly, this is the basics to what we're going to be developing in relation to the pathology that you have chosen, either chosen or been assigned. So, you can see definitely the decision-making he goes through in order to develop and begin a friendship with someone, and you're going to do that in order to diagnose a patient. So what are medical algorithms? By definition, they're any computation, formula, survey, nomogram, I spelled that wrong, nonogram or lookup table used in healthcare. It's a huge part of healthcare informatics, so if you haven't figured out yet what healthcare informatics is, this is our documentation, or how we possibly communicate with patients, provide them resources, even how we document different ways the patient is changing through our patient-rated outcome measures, but also can be in diagnostic or treatment algorithms. They can help us with that decision-making of either a diagnosis or what intervention to use, what intervention to provide, and or a prognosis for the patient. There are many different types of algorithms within medicine and even within our profession of athletic training. But some of the common ones that you might see, or you probably did or have seen a calculator with BMI, flowcharts, which is the main one we're going to focus on, or lookup tables, and we'll kind of go through what those are. A calculator can be online or a standalone if you go to a nutritionist, or even any kind of healthcare provider. They might have certain calculators that help them determine and use your health indicators to determine a certain level of health. So this could be a BMI or a target heart rate calculator, and there are a lot more. So I'll make sure to post this so you can follow the link to go search out if any of these apply to your population, which many of them do. Often we will use these kind of calculators for our underweight patients who are, female athlete triad, having other disorders. Even our wrestlers, we're using some kind of weight calculator to understand exactly how much weight they should and shouldn't be losing. Flowcharts. This is usually binary, so it's usually yes or no, and that's kind of how you're going to develop this. It's using the decision-making tree. It's very useful for clinicians in the fact that it helps you streamline and understand and move through a decision quickly with very objective measures. Kind of a silly example, a non-medical example here is your lamp's not working, so how do you decide what to do? Have you tried plugging it in? You plug the lamp in, it works, you're done. You plug it in and it's still not working, so then you might check the bulb. Well, if the bulb is burned out, you replace the bulb, and if it works, then you're done. But if it doesn't, then you have to go into a further development of repairing the lamp and deciding what's wrong with it. This is kind of a silly and smaller example of what you'll be doing. Lookup tables are databases where you look up particular standards. So, for example, a super tracker or some kind of Foodipedia. These are all resources that can be used to that tell you the standards of food you should be consuming and levels of food or water or nutrition that should be intake. So why do we have algorithms? What is the purpose for us? It's to improve and standardize the decisions made in the delivery of medical care. It does help reduce medical errors and a misdiagnosis if we use it properly, and if we have good developed algorithms, it can help us, especially as you're developing your skills, it can possibly help you move through that decision-making process so you don't miss these things. Many insurance companies have algorithms which help guide reimbursement. So if you're providing a particular treatment, they need the evidence to say, and the diagnosis to say that this was an appropriate treatment and that it was needed. So they might develop some of those algorithms to understand if things are medically necessary. But often we'll see it in medical conditions like COPD and diagnosing COPD or the severity of COPD. And some of the other similar, more pathological items that we see in mass amounts of population. So often heart disease and other pathological diseases that you see throughout the population and have specific factors that contribute to it. So what does the literature say? Medical algorithms are based on best practice, so we have to know what best practice is from our literature and can assist in everyone involved in the delivery of standardized treatment. And it doesn't matter what those clinical care providers are. It would be no different between orthopedic, an athletic trainer, a physical therapist, a nurse, as long as they understood what the tests were and what the items meant, then they could recreate the same exact diagnostic pattern in order to understand the diagnosis. And even, I use diagnosis because that's what we're doing, but we're not limited to that. That might be also providing an intervention or the prognosis, like we kind of talk about with COPD and those risk factors. So medical algorithms, if not wholly supported by high quality evidence, should be tempered with clinical expertise and patient values. So a lot of what comes to mind is like, my patient's different, my patient maybe doesn't fit under all of these things, my patient has particular values, what about my clinical expertise? I've seen it go a different way. And of course, those are very important and they're part of this evidence-based practice, but we have to take that systematic evidence and then we keep in mind the clinical expertise component and the patient values as all part of it. But this is just one section of what evidence-based practice really means. I think you probably already are using algorithms, but don't even realize it. You're going through it in your head, and that's one of the things I'm going to ask you to do for this is to go through your head on what your pathology is and how to diagnose it. But we use CPR when we're deciding to use CPR or evaluating an emergency situation. You're using a diagnostic tree in your head, so you can kind of see how this breaks down. We always are checking for responsiveness. We're activating EMS, we're opening airway, we're checking breathing, we're providing breaths. But then if the breath doesn't go in, right, you say yes or no, and then you act accordingly to whether the breath is going in. So it is important that you kind of see how simple it really can be and go through it in your head on for your particular pathology, what are you already doing, and then back it up by evidence. So things to note before you get started. I'm just going to quickly go over some of these things, but you should be focused on not making assumptions. Do not make assumptions on what it is, you need to find research that focuses on it and tells you exactly how to proceed with diagnosing a particular pathology or whatever pathology is assigned to you. You should have a finite number of options. So it should be, for example, going through, you're going to start with a history, and then slowly you'll move to signs and symptoms and maybe special tests. And within those special tests, is it a yes, a no, or an unsure, right? There are some tests that provide a unsure option, and that's okay. But you should have a finite number of options that will result for each action. And so make sure that with this, you know what the special test is telling you. Is pain a positive? Is laxity a positive? But most of the time, it is a particular characteristic, and pain might just be associated, and yes, it's a negative test with pain, and that can be a part of it, but make sure you know what the special test is looking for. And it's important to have the description of the actions, and the outcomes are very crucial to having this. So making sure that your actions are focused on what is next and moving you forward rather than the particular outcome. And then you must use data. With all of this, you're going to use evidence to back it up, and that's what the first couple of assignments are focused on, using the data to drive what you're adding to your algorithm. And although you might have some experience, making sure that you're finding the data to back that up and finding the literature. Okay, and finally, just some rules to developing your algorithm. Clinical decision trees are about making decisions. So whatever the outcome is, it should be focused around that making decisions. So how do you make your decisions? What is happening in your head, and transfer that process to paper. So that's where you can start. You're going to build and revise, build and revise, and build and revise this over and over until you have it the way you want it. But what you can do to start is to take how you would normally evaluate this injury or this pathology and write it out. Write out that process. And then you must be rooted in the evidence and find the evidence that supports it, and even find the evidence that maybe you're not even using currently. But you should remember that an algorithm should be valid among multiple types of patients. So a swimmer and their ACL tear will be no different than a football ACL tear in the way that you diagnose and focus on this diagnostic algorithm. So make sure that there is no bias among the type of patient, although being female or being certain physical characteristics might attribute to it, that's okay, but that at the end it doesn't discriminate between each population. So make sure you're really reviewing that. If you have any more questions, there are some good examples up on Blackboard, and the assignment description for your final one. And of course, at the time of submitting a draft, I will provide you feedback on where I think you need to grow and where you need to continue, but really make sure that that draft that you send in is well developed so that I have a chance to provide that feedback. And you have a chance to change anything you need to for the final submission. As always, please let me know if you have any questions, and we'll talk again soon.